Airngo Perio is the perfect option for non-surgical subgingival treatments of periodontitis and perioimplantitis, which are also minimally invasive and safer for the patients. The device is recommended for initial therapy as well as pockets from 4 mm to 10 mm. The goal is to eliminate bacterial plaque to prevent or avoid the recurrence of the disease. Thanks to the ultrafine Airngo Perio powder, polishing causes no damage to the root surface, the cementum or the implant. The initial phase of preparation takes place in 3 steps: probing, cleaning and debriding of the pockets with ultrasonic tips and/or manual instrumentation. Airngo Perio must be used in the second step, usually 10 days after revaluation, when the gingiva is not inflamed and when the bleeding has subsided. Before starting treatment, ensure that the process of reattachment of the collagen fibers to the root has not begun. The protocol for using this device in the Perio configuration is extremely simple. First, after performing the necessary X-rays, measure the pocket depth using a conventional probe. Next, insert the Perio nozzle to the bottom of the pocket, exerting the same amount of pressure as with a periodontal probe. The nozzle slides gently into the periodontal pockets. Thanks to the markings on the Perio nozzle, you can easily evaluate the depth of the pocket during treatment. Activate Airngo only when the nozzle is inside the pocket, which disperses the fine particles of the Airngo Perio powder. Then, just reverse gently, making a slight lateral movement without pressure for 5 seconds per side or surface. Just 5 seconds is all the time you need for each side or surface that should be treated. The Perio nozzle is the ideal instrument to prevent and treat peri-implant diseases. The indication and the protocol of using Airngo Perio on implants is the same as using on teeth. First, carefully measure the pocket depth of the implant using a flexible probe. Then insert the Perio nozzle and gently clean every surface of the implant. It is important to treat each surface of the implant separately and use the Airngo Perio powder exclusively with the system. Finally, you can rinse the treated area easily by pressing the stop powder piston. Thanks to the Perio polishing powder, the Perio nozzle provides a service conducive to the healing process. After each treatment, and to reduce recurrent bacterial accumulation, it's strongly recommended to use a powerful antiseptic mouthwash with a 0.2% concentration of chlorhexidine gluconate, twice a day for 3 to 4 weeks after treatment. The use of the device in the super configuration can also be used in combination with the Airngo powder for maintenance and prevention of periodontal and peri-implantitis diseases.